I'll just go right ahead. All right. So today we'll be talking about PCOS, aka also known as Polycystic Ovary Syndrome. Right. I have my scrap paper here, so I'm gonna miss nothing, just in case if I miss anything. All right. So what this condition is? Anybody know what? Okay, great. Hi, Don. Anybody else? All right. So what this condition is, it's basically it's a condition that affects the female fertility hormones, right? So the estrogen levels, the progesterone. I don't really want to go too much in the medical aspect altogether because I don't want to use any term for the confuse. But anyway, you guys can actually have your laptop to Google whatever terminology you're not familiar with, or you can ask in the comment section, right? So it's a condition that affects females, and the actual cause for this condition is not known, right? So scientists are still trying to figure out what is the primary cause. However, there are certain risk factors, there are certain things that can contribute to this, such as you may have an increase in insulin levels that can contribute to that. You can also have persons who are obese have an increased risk of obese. I don't know what obese mean, right? Persons who are obese have an increased risk of getting this condition. Also, persons who have a family history of other persons who have the condition. So, if you have a family member who has PCOS, it increases your chances. So, research has really shown that of 70% in a study, there's 70% of females who participated in a study actually had PCOS and they weren't aware. So there are a lot of persons out there with PCOS and they really don't know that they have it. So for still six on the live, I appreciate you. Thank you. All right. So some of the signs and symptoms for this condition really, you might find that females with this particular condition tend to have an abnormal hair growth. So there are times in which they might have hair under the chin, abnormal growth of facial hair. So you might see one and two hairs all over the body, all over the face, that is. So represent similarly to a man, like how a man hair would grow on the face and so. But some persons have it a lot, some just have a little bit. You might just see one little strand of hair sticking out, right? So you can also have hair growth on the chest, on the nipples. That's for the females. Remember, it's a condition that affects women, right? So you might have hairs on the nipples, like some long strands of hair, yes, and hair in the chest. So those are symptoms. Well, not signs actually that you probably have PCOS. All right. So another symptom or sign or symptom may be a missed period. A lot of people, a lot of persons actually didn't know they have PCOS until they start missing their period. They realize that, hey, oh, why me menstruate from when, and then me not see a period. I don't see period for, let's say, 5 months. There are persons who can go up to a year and not see the period. I never hear about the year and a half, but I know about a year. And all right, so the missed period also, you may have excessive bleeding, during menstruation. So some persons might, it they tend to have fewer periods than, let's say, maybe 8 or less per year, right? I still I I want to make sure that I have you guys here. You're on point. You're listening to me, and I'm not boring you to death. And we can have conversations here. So if you have questions and whatever, feel free to shoot them over. So we have established the what it is, the cause, the signs and symptoms. Let me see if there's any sign and symptom that I probably have missed. So we talk about the hair growth, and the abnormal period. All right. So you might also see that you're gaining weight as well. So that's also a sign and symptom. All right. So let's look at what actually happens in the body naturally in a female's body when they're ovulating and all of that. So originally you have your ovary, right? That contains eggs in there that are immature, they're not mature, and then they're contained in a follicle. So that follicle tends to grow, and then the egg is formed, and then your pituitary gland, or the gland in a head, or specific gland that is, right, is responsible for the release of the egg. So when things are going okay, that pituitary gland release the hormone, and a particular hormone that is, and the hormone now will cause ovulation, right? So for a person now who has PCOS, what happens really is that when well, ovulation is hindered for most of the time. So the eggs in the ovary or the follicle, what they tend to do, they are immature then. They're immature and they don't release, they don't grow enough to become mature. So what happens is that over time and they get destroyed, and then there's some that remain. They actually stay there and get larger, and it prevents ovulation in that case, right? Because in during this process occurring, you'll have an increased level of testosterone, which is male hormone. So if that testosterone is found both in males and female, but there's a higher percentage in males. So if there's a high level of testosterone and stuff, then that will definitely hinder the ovulation process, and it also increases your risk for infertility, meaning increases your risk of you not being able to have a child, right? All right, so let me see what's next. Already talk about the symptoms. All right, so for the diagnosis, so meaning how can you know? How can a doctor diagnose you with PCOS? Well, in order for you to be diagnosed with PCOS, there are a few things that needs to be done. So one, uh, pelvic examination, right, where the doctor will examine the vagina, assess the pelvic region to see if there's any visible abnormality or obvious abnormality, and then secondly, your doctor may recommend an uh, ultrasound of the pelvic region and the abdominal region as well, and that will show if you have cysts forming on your ovaries, right? So that's another one, and also you can do blood tests. So what this blood test does, it highlights if there's a high level of male hormone, the testosterone. If there's a high level of male hormone in the blood, then that can help with the diagnosis. And also, your doctor may recommend that you do a blood glucose test, and just to check your sugar levels, right? So if let's say your sugar levels are very, very high and you're having the facial hair growth, all those symptoms, then they can pull all those things together and then diagnose you with PCOS. All right. I'm guessing you guys want to know about the treatment. me see if I'm missing anything. All right, so for the treatment of PCOS, you really and truly, there's no cure for it. And what you have to do is try to treat the symptom. So all those symptoms that I mentioned earlier, you have to try and treat them. So for the hair growth, the facial hair growth and hair on the chest and stuff like that, some persons do laser therapy. An individual recently reached out to me and shared that she actually does the laser therapy where they laser the hair, so it actually reduce the amount of time that they have to shave. So laser therapy, well, they actually said that like every month or so they would shave, which is good because for persons with PCOS, the hair tend to grow like crazy. And also, I forgot to mention, some persons might experience as a sign and symptom, they might experience hair loss, bald patches. So yes, as you grow older, you might see that, your hair is thinning out and there's a bald patch. And I hope to God none of us get the bald patch. In case if that is happening, we have stuff we can try, the rice water, onion juice, and see if that works for you. All right, so back to the treatment. So for the facial hair growth, you can you can their doctors recommend, or they might recommend the contraceptive pills. And there are some contraceptive pills that really and truly they have a lot of side effects, terrible side effects, like I'd stay away from. um I'll tell you all of that in my story. But they normally recommend contraceptives. So whether pill or the vaginal ring. So I recently learned about the vaginal ring. So it has some hormone, some chemicals or stuff in it that actually helps with hormone imbalance. So those things will actually help with the a reduction in the hair growth. So the facial hair growth, all of that. So what it does, it balances your hormone levels, so make it more normalized, right? Normalized, sorry. Right. So contraceptives. Also for persons who are infertile, so they can't give birth, doctors may recommend a particular drug, fertility drug. That is. And note that some of these fertility drugs you can only try them for a short period of time. So let's say you can only take this particular drug 2 times for the year, and then you just have to wait and restart. So for the fertility issue, they'll recommend fertility drug. All right. So for the insulin levels, the high insulin levels, they can recommend nobody not takes. They might recommend, or they can recommend. Most doctors tend to recommend dieting and exercising. So when you exercise, eat properly, regulate your insulin levels, right? So exercise helps to bring down the sugar level in your blood, right? All right, let me see if there's anything that I'm missing. Oh, some persons tend to have the pain. The pain. Oh, can I forget the pain? So the pain, you can actually, they'll recommend pain medications. Note, I'm not a fan of pain medication. Yes, so just pray that the Lord help me and give me strength to bear whatever pain. But yes, you can take recommended pain medications to treat your pain symptom. And also, there are acne treatments. You can try acne treatments as well for your acne. All right. So let me see if there's anything else that I miss. All right. So for persons who try the fertility therapy and they still not getting pregnant, I have 9% on. So for persons who try the fertility method and the fertility therapy and are not getting any results, what doctors might recommend or might do is a la- a lap- laparoscopic laparoscopic procedure. I'm not sure if I pronounce it right, but what this procedure entails is like they'll make a slit make some slits on the ovary using like a nail-like thing that looks like a drill. So they'll make multiple drills inside the ovary, and then that would actually help with the lowering the testosterone levels and increase the chances of ovulation. So sometimes it works, sometimes it doesn't. Right. Also, it's important that you control your cholesterol levels. The hope of fatty food and all them something there, cut back on them. Ensure that you diet and you exercise, as I mentioned earlier. So, the risk factors for for PCOS, right? You're at risk when you have PCOS, really, or when a woman has PCOS. I'm just saying because I know there are males probably on. Yes, done same day here. Yes. So when a woman has PCOS, they're at an increased risk for developing diabetes, aka sugar. They're at risk of, I don't want to scare anybody, remember, if that's why I'm promoting awareness so you guys can take the necessary intervention to stay healthy. So the diabetes, you're at an increased risk for that. You're at an increased risk for becoming hypertensive, having pressure. um, you're at an increased risk for becoming depressed. There are studies that shows that it can actually cause persons to become depressed and have a lot of mood swings and all of that. You're at an increased risk for endometrial cancer. So what this is really is cancer of the endometrium region, right? Anyway, I can look up the part there. So what happens is really and truly in the ovulation process, you have the endometrial lining that's supposed to when it sheds off during the whole period process or menstruation process, when it sheds off, you have a period. However, with PCOS, and if you don't have a period, if you don't ovulate, that membrane or that lining, it stays and it builds up. Because remember, we're created for to have normal periods or to have periods once per month. So if that layer is not slouch off, you don't have a period, it stays there, it builds up, builds up, builds up. So when you do have a period, you might experience extreme bleeding, heavy bleeding, and all of that, right? So and the building up of the air then will cause changes in the cells, which can result in cancer, right? So we don't want any endometrial cancer here, right? So let me see if I'm missing anything, any other factor. So you can also have increased cholesterol levels, and you may also develop heart disease. Yes, you see how much things PCOS can actually cause if if you don't treat it properly. Right. Right. So I think I have covered most of what I need to tell you right now. Any questions so far? What I like boring and I can't interact with me? Any questions? No, no questions. All right. So story time, drum roll, it's story time. So yes, my full up a testimony. Somebody would say I have testimony until my teeth them buff out. Yes. But I have PCOS. Well, I had PCOS, or I think I had PCOS really. I was diagnosed with PCOS, but I'm not sure if I still have it, as in if it's still active. All right. So backtrack when I just started having my period. I started having period like when I was like 40, 15, going on 16. That's late. You know that late. Right. So I used to be concerned like myself, what's happening with me? Am I normal and all of that? Anyway, I didn't really pay it much mind. Then my period comes, and after that, like let's say it comes for two months straight back to back, not back to back, 2 months. I see it normally for 2 months, and then I realized like 6 months, nothing. Say, mommy, and she say, this normal. And remember, I'm new to the whole period thing. I don't know what's happening, what to expect, and all of that. So she said that normally when you just start, things like that happen. I'm like, okay, fine. Then 6 months goes to a year. Yeah, a year. So I enjoy that time. And I know persons with this condition, this is just the plus of it. You don't get no period, but it's not healthy. Anyways, so finally, my mom took me to the doctor. Went to the doctor, and um, the doctor he didn't recommend any tests really. He just placed me on contraceptives, oral contraceptives, that is. So at the age what 16, 17, thereabouts, on oral contraceptive. I was taking this particular one, minigynon, and oh my god. Whew, I swear it was the fattest I've ever been, and I didn't like the side effects of it all. I don't remember if I was moody or anything like that, but I was just not myself. I didn't like it. Anyway, so after that, I forgot about this whole period thing and stopped taking the pill. I'm non-compliant patient, and fast track to when I started college. So in 2013, so 2013, I started having severe pain, severe abdominal pain. Let me see. I joined late. Not sure if you touched on, but they say that persons with PCOS have fertility issues. Did they? If yes. All right. So persons, yes, I had mentioned it. I had mentioned it. So persons with PCOS, let me just sidetrack a bit. So persons with PCOS tend to have fertility issues. It's possible. So for majority of person, let me rephrase that. Mislead you. Right. So yes, doctors will tell you that if you have PCOS, you might have fertility issues. You may have difficulty in becoming pregnant, right? But it doesn't. There are persons who actually have PCOS and actually give birth. They have their child, and I'm a living testimony. All right. So there's hope for you. I hope this encourage you. What do you do differently in order to conceive? All right. So in terms of what you do differently to in order to conceive, so I had mentioned earlier that the doctors may recommend fertility drugs, and these particular fertility drugs you're only limited to take it, like let's say 2 times for the year. And so yes, so that may work. And if it doesn't work, the doctor might recommend surgery, right? So surgery entails removing the many cysts from off the ovaries to um, enhance ovulation or to encourage ovulation. It's not 100% that it will work, but it can work. All right. I hope I answered your question well. All right. So where was I? So I was at where when I was at UTech. So I went to the doctor because I was having severe pain. When I tell you 10 out of 10, them bali pain, like really, really serious pain. And I was like, what's happening to me? I was having the symptoms, the hair on the chin business, hair growth, and excessive hair growth on the legs, and the above navel region. I forgot to mention that you might have excess hair there as well. And so he interviewed me and did an assessment and said I might have that condition, the PCOS. But he actually sent me to do a pelvic ultrasound, right? And he also recommended a blood test, which I didn't do the blood test. So he allowed me to do that, and he reviewed the results, and the ultrasound actually showed that I had multiple cysts on my ovaries. So not just one of the ovary, two ovary up. I had multiple cysts on both ovaries. And so that was why I was experiencing those excruciating pain and all of that. So he placed me on Lindanet 20. I told him I didn't want any minigynon or any of them, something there. So he placed me on Lindanet 20. And so far, well, while I was using it, I didn't have any major side effects. Like persons would say they have mood swings, or they feel they have a wake up bump on the face and all of that. So I didn't really have any symptom, any negative reaction to the Lindanet. While I was on the Lindanet and time went by, you know, it calmed down. Doctor also gave me some pain medication, Paralgin, and I took it like 3 times, and then that was it. So I would just fill the prescription, pack all of the pill them in my drawer. Don't be like me. As I tell you, I don't like taking pain med. Anyway, take your medications. So, alright. So, with all that said, time went by and pain on and off until I started experiencing diabetic symptoms. Yes, yes, diabetic symptoms. I'm like, oh God, I can't be diabetic. And so I went to my doctor. Well, I was experiencing extreme thirst, frequent urination, ever hungry. Know them with it, right? So, and them, well, they tend to say if you pee and you see like ants or something following your urine, it could be an indication that you may have diabetes or some sugar off balance go on, right? So for me, I said, all right, I need to get this checked out. So I went to my doctor, and he recommended that I do a blood glucose test, and which I did, and the results came back normal. So like, thank God. So during that process of being diagnosed with PCOS, I ensured that I started exercising. And I remember doctor saying to me, you need to hurry up and get married. Hurry up and get married, and try start trying from now. Well, not even hurry up and get married. You need to hurry up and try get a child from now, because things will get difficult down the line, and chances are you may not be able to have a child. I say, hey doctor, you don't call the shots. God call the shots. That's exactly what I said. Like, I gotta have the final say, right? And I was not worried one bit. So even though all this was happening to me, I'm like, God, you have everything. You control my destiny. So if you want to give me a child, and if I want a child, I know you're gonna give me a child. Anyways, so with all of that, I realized, as I said, I did the glucose test, and everything was fine. Hi, Trudy, sending me love. So I did the glucose test, and everything was fine. So and I had in between intermittent pain, and I remember one time I started experiencing pain on a different level. Like the pain was so severe, like I like rolling pain. Like I have to be like I was on the floor, and I was rolling and rolling and rolling, because I didn't know what to do with myself. And I was like, there and then I remember telling my best friend back then, my husband now, yes, that, you know, may I give him the death speech. I think Mega did. So, I appreciate you, yada yada yada. I'm in so much pain and all of that. And so I remember that same day I called either I called my mom or she called me, and I said to her, "This is what is happening." She said she was going to a prayer meeting, and I told her to pray for me, and I told her exactly what I was experiencing. And from that day onwards, I've never experienced such pain relating to PCOS. It was all gone. All the pain, it just went. So I've been living pain free as it relates to PCOS. And for the signs and symptoms on my end, I tend to have beard growth. You won't know because I try to shave it every day, and the hair on the chest. So those are my symptoms that I battle with. I'm not affected by mood swings and all them stuff. So those are the symptoms thus far. Well, I have done ultrasounds, and since I found out that I was pregnant, um, neither of the ultrasounds showed that I had any cyst on my ovaries. So either God well, not magically, miraculously removed them, or they burst over time, or because I actually control it, that exercise. Note briefly, I haven't been on any specific diets, but I used to try to be consistent with the exercise. And so yeah, I'm saying this. I did this live, so that's in short my story. So I'm not sure up to now. I probably need to go again and do another check to see if the cysts reappear or what. But so far, they say they haven't seen any, and still battling with the symptoms. But I don't let it bother me because I can get rid of them. Yes, sometimes I might run outside and I'm like, oh my god, I got beard. I need to turn back. They can walk with a razor in the bag, so I can just shave it. Some persons they can't use a stick razor. Sabrina Atkins, why you delete your question? Right. So some persons well they cannot use razors, so you have to find ways and means. Just like I had recommended you can probably try the laser therapy thing. So that works for me. All right. So any questions? I want to encourage you though. My main reason is to encourage you. My main reason of doing this live is to encourage women with PCOS who are having the excessive bleeds. I know some persons probably say, "Oh, how do you manage that?" As we say, try to control the symptoms and let's see how well it improves all of that. Right? I want to encourage you that you're not alone. There are persons with PCOS, and for those persons who are trying to have a child and unsuccessful because doctors say or they hear that say I will not have a child because I have PCOS. I'm a living testimony. I have a 4-month-old baby boy and he's perfectly healthy, and I had PCOS. I have PCOS, right? So you can go through it, you can triumph. It wasn't a question. Okay, that's fine. So you can go through it, you can go through your journey. How I overcame my journey really was support. I had the support of my husband then, who was my best friend. He was there throughout. Sometimes he would just come by and like when I'm in my pain, having my pain, he would just sit there and not say nothing. I'm like, why this young man just sit down and not saying anything at all and whatever. But it helped. I really appreciated it. I know that there was somebody in my space that had the support. Right? So you need a support system. You have it need your friend to say, Ray, you know, me I feel moody, pray for me and laugh it off or try find some ways and means of dealing with it. Right? So you don't need to be depressed. You can fight those depressive symptoms, those depressive thoughts. You can kick them to the curb. You can overcome PCOS. You can y- remember we said there's no actual treatment not treatment, as in no cure, rather. There's no actual cure, but we can try to limit those symptoms and stay on top of our game, right? So I'm encouraging you guys to be strong. Be strong. You can do this. God is still in the healing business. God can still open up the womb. He can still allow you to give birth to that beautiful baby boy or baby girl that you've been yearning to give birth to. And prayer also worked for me because I remember I always pray to God and ask Him to help me through, and having faith, even at the size of a mustard seed, just a teeny weeny ounce of faith, you can move mountains. So I implore you to have faith in God, believe Him, work on it, do whatever you have to do, whether the exercise or the treatment, the necessary testings, do what you have to do to keep yourself healthy. And remember, we've highlighted the the negative effects of having PCOS, and we don't want no diabetes, we don't want no cancer. So we come against all that today, and we're speaking positivity, and we're all overcomers, right? So any questions, guys? Not no one, no. Oh, not so boring. Anything you want to know? Any questions? Come, keep the questions going. Wait, let me see if I may miss anything. I'm scrolling. I'm not seeing. Blessed by faith, saying amen. Yes, amen. Amen. God can. Any questions? No? All right. So I guess some of you probably you're fearful of asking questions online because yes, the person might actually look you up and see and say, "Oh, this girl have PCOS." Well, feel free to message me on Instagram if you have your questions and queries. You can message me. Instagram name Nikki Natural, right? So I'll definitely respond to your messages. I hope I encouraged somebody. I hope I helped somebody. I hope somebody was enlightened by all that I shared. Or else if nobody not enlightened or nobody not get anything, what would be the purpose of this life? But I hope you guys were encouraged. And so yeah, so no more questions. If you don't have any more questions, I and it's time to end the live. So I'll give you 1 more minute. Just give you 1 more minute because maybe somebody's typing. I'm not seeing any option like that indicate that somebody's typing, or I don't want to end the live and somebody have a question, and then so I'll stick around just a little bit longer. Alrighty. So Abba, are you still here? Are you still here with us? Tony, that is. Are you still here with us, Yanisha, or are you gonna enjoy your birthday celebration? Okay, Tony is here. Thank you, Tony, for staying. Yanisha, not there. Okay. All right, guys. So I'm going to end it right here. So thank you guys for tuning in. Thank you for taking the time out of your. Well, I know you guys have enough Zoom meetings to attend and you take the time out to come here. And I really apologize for the technical difficulties. I don't know when I'm going to get this live thing right, but pray my strength. And I'm asking you, if you haven't subscribed to my channel, please go ahead and do same. Share with your friends, your family. We want to promote awareness about this condition. We want people to overcome this condition. So we don't want any more diabetes because of PCOS. We don't want any of that, right? So share and inspire. Like this video if you appreciate the content. Big up, big up. Your nice self. Thank you, Trudy. Oh, big up, Jesus. All right. Lizette saying bless you, Sister Lizette. And it's done. I hope you have something to take away to share with your wife. Is she on? Is she on the live? No problem, Monique Smith. You are welcome. All right. You're welcome, Cheyenne. Cheyenne, if I pronounce it right. I hope I did. All right. So go ahead and like, subscribe if you haven't, share with your friends and your family. All right. Not sure if I'll do another live again. too much too much worries. But anyway, thanks again, guys, and you take care. Signing off. No. Bye.